The SHA menace continues to be a menace, and many people are saying many things. We did hear from the CS Ministry of Health just the other day when she did a tour in one health facility, and she told people SHA is working. Come on down, basically, and get your tickets because everything is all right. The Rural and Private Hospitals Association is saying, well, okay, that's great, but it's not working for us. So we're not going to be offering you services under the SHA cover. So in that respect, it's not working. Depending on where you go tomorrow or today before this impasse is actually dissolved, is that you will not be able to access care in some private and mission-based hospitals. And we're going into now the 4th week of these rumblings that have come out proper. And the question that we are trying to ask ourselves, even as we look into all of this, is, are the lines so terribly crisscrossed that we are not able to unravel it and actually get this thing to work?
The lines are actually not crisscrossed at all. They are fuzzy, but they are fuzzy because those who know what is happening are not coming out and saying, this is what is actually happening. That constant repetition. So we are told you have primary health care, okay? SHA is not SHIF, SHIF is not SHA. SHA is the authority that covers
all the
entirety of the healthcare program that the government has in store for its citizens.
Yes.
And then you say, to actually be able to actualize and activate the primary healthcare program, what is needed is this. This is where we are with it. So what we can do currently is this. But in order to ensure that we are not overloaded, we have a whole group of people we call community health promoters. Their job is to do the following, and in so doing and carrying out their mandate, they'll be able to reduce significantly the burden that is often felt at the health facilities by ensuring that the diseases that take you and the accumulation of it that takes you to hospital are nipped in the bud. Okay? Then they tell you this one we call SHIF. SHIF works like this, your contributions. So what we need is this. Where we are at the moment is this. Okay, perhaps we're not telling you this thing well, so tell us, what do you want us to do so that we can understand how your contribution can reach the mark that it's supposed to reach? Then you come to the critical care and emergency service and you say, this one, we need this, but we are here at the moment. It is a conversation that is difficult if you want it to be difficult. If you want to be honest and you want to have an honest conversation, you can have it. But tell the citizenry. The citizenry keeps hearing, oh, this thing is really wonderful. Actually, on paper, it is beautiful. It is truly beautiful. And tell them, this thing is not going to be achieved in a hurry. Let us tell you, for the next 2 years, this is what we're going to achieve. The other 2 years, this. Walk the journey. Chart the path. Let it be understood. And then let the citizenry walk the journey with you. But so long as we hear discordant statement, it is working. What is working?
And just looking at that, in that same light, transparency is a huge deal. Transparency, communication and transparency. And like you said, walk with the citizenry. Do not be at the top saying, well, this is working. And indeed, it's beautiful on the paper. Even the intention of it. Everyone does deserve quality health care. Universal health coverage is important. Every corner of this country deserves it. But if you do not involve people and they do not really have that like the outlined program and understanding of it, they equally feel cheated or just left out. Look, if these people could actually come out and have this conversation, and remember last time we were telling the deputy director, she done in communication, he actually acknowledged that there is a problem with communication. But then here's another thing. The amounts of money owed to the private hospitals, they're saying, well, we are ready to talk, but there's some level of commitment and honoring that commitment. Because there's one thing to commit, and there's another to actually honor the commitment.
In as much as there's a communication problem and a big one. Because I think that's the bane of many governments, and it's not just the Kenyan government. I think the bane of many governments is that you actually don't communicate on what you're doing. And what that does is that it throws people into a state of confusion and chaos. It's because you're not telling them how this thing will actually to run. Now, the Senate committee, and that's a direct answer to your question, Adrian, that the proceedings continued yesterday, and there are questions that they're asking. We did see Senate Majority Leader Aaron Chariot put this question directly at the doorstep of the Ministry of Health, and not just the Ministry of Health in its entirety, but at the Cabinet Secretary's doorstep, and said, you have failed by not being able to communicate exactly what's happening with this thing. The information that you're giving is counterproductive to what is actually happening on the ground. So there's a big problem there. But you know what? We had the CS here again yesterday, and this is one of the things that he said. We are trying to put money into health. Now, you see where they're trying to put money? Those tiers that you talk about, CT? 1 and 3. That's the problem.
2 here.
2 here is you.
And you've paid for it.
Yeah.
And you will get, when you hear it's working, it's 2 that's working.
2 is working. You're going to go to hospital today, and you need to be admitted for whatever reason, a thing here, 2-3 days and the whatever. It'll be fine, and it'll pay for it because you've paid for it. They are not putting money in 1 and 3, and those are strictly government-funded funds. They are the ones that are funded by government, and not enough money is going there by the own admission of the CEO of Treasury, which is the CS, who said, you know what? We are trying to balance things here and there, but it's going to be dim for a very long time. And this is my question.
Took a deep breath. Thank you. No, go.
How do you budget for something? You know you don't have the money for it. You had a system that was not failing. I mean, it was maybe hobbling along, but it was not, just sliding down the hill on its bum. It was working at some kind of level until and unless you were able to be sure. Because let me tell you, you see SHIF that's working right now? That's SHIF, the fund. It's the same thing as NHIF. There is no difference, by the way. What the money that you put in NHIF for you to be able to go to hospital and they pay for your bed and whatever is the same thing that's happening at SHIF.
Right.
So there's actually no difference. It's just that N changed to S. There's no difference. So until you're able to get your ducks in a row, why do you want to jump the line? You don't have enough money to get it done? Don't do it. You don't have enough wherewithal for it to happen in the way it should happen from point A to point B. Then don't do it. Wait until you can do it. Like you keep saying CT until we're almost tired of hearing. You piloted the thing.
Yes. I was coming there.
You piloted the thing. And you knew these were where the bottlenecks were.
You did.
So what's the point of a pilot if you're not going to use the results from the thing?
The idea was to just upscale.
Because what's the essence of the pilot? And I was coming to that because, when you start something new, really, you should be prepared for anything. Systems failure just happened, pop. Someone actually challenged me and said, was there an alternative fallback plan? When you pilot something, you're looking at, these are the possibilities, this is how we could handle it when it happens. But this one, I don't know. How did it just, how did you get here?
The thing about piloting, we had a process that was ongoing and had been ongoing. What we're piloting was this new thing.
Exactly.
Okay? But the other was going on as usual.
And CT, they didn't do this in one place. They went to Isiolo, this part. They went to Kisumu, this part. They went to Machakos, Makueni, this part. And then they went to Nyeri.
Yes.
So you went to different parts of the country with different circumstantial elements playing out. So you were then able to see this can work, this cannot work. This can work, this cannot work. You did it for 6 months. You got results. What did you do?
Those results, believe me, would give you sufficient. They did roll out the findings. Now, the understanding of piloting is this. It informs you whether you can continue, and if you can, what you need to sort of like fix as you continue, what you need to enhance, etc., etc. Or perhaps just need to dump the whole thing because this thing doesn't make any sense.
And it's not working.
Absolutely. And that's okay to say, you know what, we've gone through the process. That's why you go through a process to figure out if it will work or not.
You admit it.
Yes. If you listen to what the citizenry are saying, counties where the pilot took place, you'll find there are fewer complaints. Because when you pilot, you actually put the system in place to see how it works. So it is in place. So when you say you have this new system, these people already have a hang of what it is you need to do and how. Okay, it's called tweaking. Now the understanding was that from 5 you move to 10, from 10 you move to 20, like that. Okay, so that over a period of time, you'll say, by the time we get to 20 to 28, the entire country. See, Brazil has a decentralized system of government when it comes to healthcare like us. They have a universal healthcare system which actually works. Okay, it has many hiccups, many hiccups, but it works.
It works.
It works.
It does work.
Okay, despite the hiccups. See, the hiccups tell you that it is working. That's how you can actually get to see the hiccups. If it wasn't moving, there'd be no hiccups because essentially it would be dead. Okay, the will to see this thing work, despite making it a political statement that we brought in something new, the provision of healthcare that is needed by the citizenry is understood by the Ministry of Health. It is understood intimately. What needs to be done and where it needs to be done is understood again intimately. That little move to ensure that we actually set the ball rolling in the direction that is needed, not the politics of it where we are talking about what needs to be done, but what actually needs to be done, that unfortunately has been lacking.
I then have to ask the question, because that information that you would derive from a process, why are we so, is it shy or are we afraid to use the results? Because that's why you collect data and information.
Right.
Because then you can see the trend and the pattern, and you say, okay, over this, when we applied 1, 2, 3, this is the result that we got, and actually works. We can take that and we can extrapolate that to the rest of the population. It can work. Why are we afraid to do that? The people who are in Muranga under Kangata care, are they mad?
No,
they
they're
have
not.
2 heads. Something wrong with them. The people in Makweni under Kivuza Kibwana who set up the health system under which at some point governor himself went and said, you know what, why should I go somewhere else? I've touted this thing for the longest time. He had surgery. He did it right there at the Makweni level 5 hospital. The people who operate these, are they not Kenyans?
I believe they are.
What's the problem?
believe.
Why are we so averse to using information that you've gathered from within a Kenyan population? City, you do this means testing, you do this research, you understand these numbers and collection of data, collation of all this information. Why can't you just take that then apply it to the rest? Why do we have to be so complicated? Because you know what that does? You see all this speculation that's running rife here, back and forth, people saying, well, you know what was happening really was that there was a platform that was being set up and we needed somebody to be able to benefit from this platform. You people who are here shouting about, oh, how you need level 1 and 3 to work, that's your problem. You're shouting, it's okay. But the people who are meant to benefit from the very beginning have benefited as you're shouting.
You see, if you understand the care and treatment that is provided for people who have the virus living in them, those who have tested HIV positive and who are on ARVs. The current process that we use that is referred to as test and treat, those who understand how ARVs work on the body and how they work against the virus didn't wake up in the morning and do this. No, a process was undertaken. Before, the understanding was when somebody has a viral load count of a certain level, then you put them on treatment. There was a study that was done. It was meant to be in 3 countries, Kenya, Uganda, Tanzania. It ended up being in Kenya and Uganda. In Kenya, it was in the areas of Ombat and Migori County. Uganda, it was the Mbarara area. It was called Sustainable East Africa Research on Community Health Search. That is the study that now came up with the definitive understanding that if you start putting people on ARVs at the time they test positive, the outcomes improve significantly for the person. And the likelihood of the viral load getting to the point where they're almost undetectable was extremely high. So, test and treat was implemented.
Yeah.
You asked and I've answered.
Yeah.
The research is done, and over a period of time, this one needs to be implemented. It didn't take long. Papers were published, presentations were made, peer reviews were provided for, undertaken, and they said, look, this is what we need to do. Okay? Now, that process was actually what we followed, the likelihood of it, or the likeness of it, when we were piloting with universal healthcare.
Okay.
That information was clear as to what needs to be done, the path that needs to be followed. Now, you asked about Kangata Care. You asked about what was happening in Makweni.
Yeah.
These are people who understood how to use data and how to use available information in providing health care. Those are examples of people who are using resources that are available to provide the healthcare needed. Okay? Now, you don't need 10 examples, not even 2. You only usually need 1 example to realize that this thing can be done. The question is how they're doing it.
Yeah.
You find it begins with the will to do it. Okay? And then they ask, how best do we do it?
Yeah.
And then they begin the process of doing it. Okay? If you look at the Brazilian model, local resources were also involved, meaning all the levies and taxes that the county government, or what they call the municipalities, were also used together with the national resources. Okay? We have a system where anytime you ask people to account for how it is the money is used, a blame game begins. But this money is delayed. Yes, yeah, but is it not eventually given? Yes, you see, but by the time it arrives, say, okay, no, okay, but it arrived. Yes, okay. When the year ended, how much of it had you gotten? Yeah, but there was this quarter that they didn't pay.
No.
Yeah, but the 3 quarters that you got, what did you use for it? No, but this quarter that we were expecting was... So you realize this conversation never really gets to an end. And then there's the ganging up. All of a sudden you hear, we as the Council of Governors, this is a statement we're making. Admittedly, they have more information than I do.
True.
But I'm always puzzled, and I'll continue being puzzled. All those billions being given, all those billions, monies that none of those regions can claim they had ever seen in the time since we had devolution. Can we sit back and say that we've seen what the money has done really? Huh? There are changes, yes, and people keep talking of, it's better than it was before. Forget that story. It's nonsensical. We know things change. We are asking, can we see where all the billions have gone to? You don't answer the question that's what no one asked you. Can we see?
I like when you said the will. And it's good. The intention is good. All right? Let's just appreciate that, because you're trying to make sure we all have it, which is a good place to start. But the how, the plan. And I don't like that I'm bringing in this comparison, but I feel like I should. Is it just that we like to... You see, they say you have to concentrate on one thing, but that's not how it works. But you can do bits of things in a hurry. I'm saying this. University funding model has its own issues.
It does.
Even how it was rolled out. What is the hurry? Try and figure this thing out before you rush into it. There is the CBC, which is okay. The task force came in. But then again, another thing. So there's a lot of things staggering. I'm not sure if I should just be guided why they're staggering. Now, universal, and these are very basic things. Education and health. Don't play that. Education and health. Don't play that. That actually is who I am today. This is what makes me who I am. And food security. Don't play those 3 things. Now, it's a good idea, but how are you rolling it out? And if we really had it right and we didn't have to rush through it, and also look at where it has worked, map it in here and make it work, and then communicate adequately, a system has to have issues. Of course, errors. There's always hiccups. We're not disputing that. But how they are actually addressed so that they work is where the concern is. It's not like we don't expect hiccups. I believe every normal Kenyan knows that even in your own household, you might have a good plan, but it might not always be a straight line. But how it is addressed is the problem.
Then you then have to ask whether the genesis of the intention was for it to work through and through.
I choose to trust. What do you think?
No, I'm sorry. I just have to look at what I'm seeing.
All right. You see.
Because the thing that is working now is the one that has always worked. This new thing that you want to come and introduce, as good as it may sound to the ears, is not working. And especially where you say you're going to apply funding for it to happen. And you've set it up on a system whereby the creators of the system in the very initial stages have been paid what they needed to set up the system. Yes, no. Yes. We heard the tunes of 104 billion that was going to be put aside to set up this whole health system. Who got that? Is it the people who go to hospital to get treated who got the 104 billion? No. Is it the people who need to be treated on a daily basis? No. Is it the hospitals who were owed money from the previous system that are being paid from this 104B? No. So, was it not designed from the very beginning to fail?
Is it?
Is it working?
I am following my sister.
Is it working? If it is working and we don't...
The CS said that the people who, in fact, the director said the people who write to him and said, this is really good. Did you not hear? It is really working. He gave us success story.
What was
did
he referring
he specify to you
people
at
who
what
texted him.
Did he specify at what level it was working?
No, that part I don't think was clear.
You see, these conflicting stories, break it down. When people say, we've asked this question over and over, when people say it is working or not working, what exactly is not working? Simple enough question.
All right.
Because you've gone there to seek healthcare. What is it that you sought? Because visits to hospital don't all conform to one ailment.
True.
The needs are different. So what is it?
Exactly. Brian Leshanga made it very clear to us that if you walk into hospital today, save for the current impasse that's going on, if you walk into hospital and get treatment, the hospitals are actually doing the favor and having these services on credit, hoping for a time where government will actually fund them for the work that they have done.
Right.
That's the system. That's how it normally works, even with insurance and things. You pay
Actually,
and then
that is exactly how it works.
Yeah, you get paid later. So when you say it's working, it's the hospitals who are actually giving credit to the government.
And these complaints that you hear of, private insurers of health have had similar problems. Some have closed down because of these very same things that you hear.
True.
But what they do is, if you are under certain insurance cover and you're in hospital, you will be visited by a representative of that insurance.
Yep.
They'll send you a card. They'll come and visit you and say, I am so and so. I work for this. I just want to find out how you're doing. Meaning, they want to physically verify that you are indeed in hospital and you're indeed receiving the care that you're supposed to. And they employ insurance companies employ medical doctors now to do this very same thing. Why? Because they have suffered in the past. Collusion between this group and that group and this group and that group. People who don't even exist. Now, in this country, where, for instance, remember we were talking about this fund, the Hustler Fund.
Yes.
And there were reports of people who had received loans and were yet to be born. Remember that one?
Yes, I do. I remember.
Yes.
Some are not even 18 yet.
No, those are the ones who haven't reached the age of maturity in the country.
But they're in.
Yeah, but some hadn't been born.
Yes.
Meaning, by the time they applied for the loan, okay, later on they were born, yes.
Yeah, but by the time they had applied for the loan, they didn't exist.
Now, when you hear such things, you either think someone is spinning a very tall yarn, or you think, what sort of people are we to go to this extent to be fraudsters? Because that's
Exactly.
what sort of people are we?
Fraudsters.
And you see, the problem
big.
for me is, tell people what is happening. If you're supposed to fund level 1 and then you don't have the money, guess what? Tell them that that's not happening. But people don't want to tell you and that's why I have to question intent. From the very beginning, I must question intent because there's already a certain level of not even mistrust, but distrust. So the minute something that you said is going to work is not working, people are going to start questioning and asking, what's going on here? So then somebody else wants to go further and say, okay, are we looking at a situation where you created a platform so that a very few people in this cogs in this wheel then would benefit? I have to ask, because it would not be the first time that something like that has happened. Are there certain individuals who are meant to benefit from this system being set up? Because if not, why is it not working? Or if you knew that at level 1 and level 3, the most, if you shake everything and turn it upside down, the most that you can get is 100 billion. Then let's say that we have a pool of 100 billion, first come, first serve, and as we continue, we'll move on like that. What is wrong with just saying it as it is? You throw people into a mess. Here they are and they're asking you, somebody has a bill of 600,000 shillings. They've been in ICU for 3 days. Then you pay 80,000.
And guess what? These are the same people you keep urging. Please, go out and register. Take your keen with you.
No.
I know the shift part is working.
No.
But you see, the government has to do its part as well. And I'm very proud. I'm a very proud Kenyan. I'm proud of Kenyans who are loyally and patriotically, if there's a word like that, remitting what they have to through their pay slips, or some actually just doing it from their, they're self-employed. So even in the analysis that Brian gave, the part that is working is Kenyans' part to play. I have a great concern with the government's part to play.
Would you believe that we're actually in a country where there's a time in our history people were volunteering to pay taxes?
Yes.
Yeah.
Very true. Let's pay because we see that it's necessary for government to do 1, 2, 3.
And it's working.
And people will pay.
And it was working. I think they were seeing the results of it.
They were paying.
They were paying.
The people should register.
Yes.
The government, however, must also take the time and bother to continuously get people to understand what this whole thing is about.
Yes. Absolutely.
So that as you register, you keep hearing so you understand. If there are limitations, you are told so you understand.
Yeah.
But you keep registering. Because the truth is, In the absence of everybody who's eligible registering, this system will not work.
Exactly. What's wrong with telling people the real problem around a particular issue, especially when you're dealing with a few of you in positions of leadership vis-a-vis millions of people who are going to access this system?
Truth telling, I think we're a bit stiff-necked about this, wouldn't you say? People know what needs to be done, but somehow you want to find a circuitous way of explaining something which is fairly straightforward. We have a system that needs to be funded. The funding will come from people paying a certain percentage of their salaries. The other funding will come from the government. Now, government funding comes from taxes.
Yes.
That's how government doesn't sell beans or flowers or cars or no, government doesn't do that. Taxes, that's how they get their money. So when people pay taxes, the government has money. But people can't pay taxes if they do not have the money. So how do you get people to have money? You ensure that the economy is vigorous by ensuring that there is some very serious circulation of money within the economy. Now this the government can do. This only the government can do. There's something we've been calling pending bills for the longest time. 95% of those who are owed this money are from 1 shilling. If we just use that as a point of departure, probably 1 million shillings, not even 10 million. Okay? The others are the ones who are above that. Now, if this money, hypothetically speaking, was released into economy, there are many things that people are not doing that they'd be able to do. People who have done business with government and haven't been paid means they also haven't paid people who facilitated the business that they were doing. And the chain goes on. If the money is released, guess what happens? All this money cascades and goes down, and suddenly people are doing what they were doing before. So there's money in the economy. Guess what happens?
What?
The government has more people to tax. The government has more sources to tax. Guess what? The government then has more money. It's not complicated. But so long as that doesn't happen, we can talk until we foam at the mouth. The situation that we see will have a downward spiral. No, it will not have a steep incline. No. Now, here we are. What then do we do?
I need to keep asking the question, though. Why would you put something in the budget? Because you don't just budget and walk away. You appropriate as well. It's an entire bill that goes into the same process. And mind you, the budgeting process does not take place on the 1st of June. The budgeting process for any fiscal year takes place in September. That's when it actually begins, and you start to see, okay, this is what we're going to budget. This is what each department of government needs in order to function. You go through that entire process for the next 6 to 7 months. You're on it before you then come. But you have projections, and you know that this is the number that we're looking at, and that's why you're able to release that information December, January. You can do that because you've been into 3 months of this. You spend a lot of time. People have been crunching the numbers. The bureaucrats are sitting in treasury losing their hair and going grey overnight because they're trying to figure out how we're going to do this thing. You get it done. Then you go back to Parliament, the budget making body, right? They're going to tell you how you're going to spend the money and where you're going to spend it from. Then you go through this entire process and you say, okay, fine. We're going to spend 6.5 odd billion shillings on this. We're going to spend millions on this. We're going to spend it on this. The appropriations means that you go into a process whereby you say, this is where we are going to get it from. So you know ahead of time. It's not a guessing game. You're not stabbing, you're not playing, Spanish piñata in the dark and trying to land on something. No, there's a formula. It's been applied. You have the funds. You get it from somewhere. You have budget lines.
Yeah.
Then some kind of mix of voodoo and juju happens along the way. And then you say, we don't have the money to have it happen. Not only do you say that, but then as a result of that, you then plunge people into an unrecoverable situation for as long as you're not able to sort it out. It baffles me.
Personally.
As I am like this, with my full chest, I am confused.
Okay.
I am completely, I don't understand it.
And I'm imagining
I don't get it.
I'm imagining a listener and a viewer who is even now more confused because you with your full chest
I
and
don't
all this
understand.
information you have, you do not understand. Now listen, somebody else is even going goo gaga with this scenario, which is not even funny. Now, I was trying to look up what other issues surrounding SHA, because of course finances, major is financial. But look at this, an analysis was made, and the social health insurance, for those who are trying to figure out what this SHA is, in Kenya has faced a number of complications, including not just the financial, technical failures were witnessed, delays, financial uncertainty, and within the technical failures, the digital claims management system has had security flaws and operational issues. We've had the SHA portal that has been non-functional, causing delays in surgeries in some cases. There have been issues with patient verification, including non-functional credentials and automatic lockouts. Now, that is bad. That is not really good, especially when it comes to you presenting yourself and you're seeing issues with your verification, non-functional credentials, and automatic lockouts. On delays, there have been delays in processing claims, there have been delays in pre-authorizations for critical procedures, and there have been delays in outpatient services. This is just an analysis that came forward. Also, in financial uncertainty, what we're talking about today on the stalemate, etc., hospitals have had to restrict or deny services to patients relying on SHA, even most recently with the private hospital and religious-based institutions of healthcare. Hospitals have had to ask patients to pay cash upfront, and that's happening even as we're speaking today because of the debt that was transferred from NHIF to SHIF. Or SHA, if you like. Providers have expressed dissatisfaction with low reimbursement rates, etc. So when we're saying SHA is not working, it's a myriad of issues that ought to actually be looked at and communicated in detail. But we're not saying stop using it. But it's not working, throw it out. But if it can work, let's be clear on the line that works.
No, we're just saying make it work.
Yeah.
For me, I'm just saying make it work. And
do it quickly.
Is there shame? Or is there shame? Maybe to a certain extent, and that you have to peel back on, whatever steps that you've made. But is there monumental shame, unrecoverable issues with coming out and saying, actually, you know what, guys, this thing that we thought was going to be able to work in this manner is actually not working. Can you just give us a minute to figure it out, and then we will come back with something is there a problem with doing something like that?
The discussion in and of itself from a theoretical perspective is sound and there's no problem. But since ideas are implemented by individuals, you have to ask those who are supposed to implement it, where do they find the problem? Mm-hmm. What is it that they find bothersome? What is it that hinders them from having a simple, honest conversation? This issue of an honest conversation we've had almost from the time the situation was
started.
Yes, we've said just this conversation of folks, this is where we are, this is what we need to do. I particularly liked the conversation we had with CS Treasury Mbadi. Mm-hmm. There are things he said that are not often said. Mm. We made mistakes. Most government officials that word will not escape. In fact, I think it won't even be formed in their brains before it can be uttered.
It can't.
We are going to do the following because this is what we now need to do. We will live by our means. What that means is this. We are not going to be borrowing into the future. What that means is there'll be a shortage of this. There'll be a pinch here. It's the beginning of an honest conversation.
Right.
So this issue of SHA, when people say, can it work? Actually, why don't we just dissect this thing?
Yes.
When you say a system is working, what do you mean? There's a promise that was made as to the implementation of it and the outcomes that you would see. So if you're told it has been implemented and the outcomes that you were told you would witness are not coming, then you wonder, yes, the question of is it working now comes into being. Okay. Then if you want to get granular, you say it's a complex system. So let's find out. It was supposed to achieve 3 segments of service.
Right.
Are all 3 not working? And the answer will be no.
No.
Mm-hmm. No. 2 are not working. The second one is working. 2, the first and the third,
not so much.
Major hiccups. Second one, yes. So when you say, are there times when it has a problem? Said maybe, but does it work? Yes. Okay. And that's why people who've registered can tell you, I have registered and I got the service.
Yeah.
Okay?
Yeah.
But our situation is not that straightforward. There's a hairpin bend. They are the service providers. Mm. And then history comes creeping in. There was NHIF, it owed money.
Yeah.
Now, in between, payments have been made to care providers. In the intervening time, promises of schedules have been made. Those schedules have had hiccups, they have not been met. So when you hear conversations, they seem to be staggered. Oh, we made payments. Yes, payments have been made. In accordance with the agreed upon plan, not necessarily. Okay, has a new arrangement been made? Because if this one isn't working, the understanding is, let's get back and talk again and see what's possible. Because when you say we want to do this, it's based on an assumption that certain things will be constant. If they are not, what then do you do? You call the people back and say, folks, please come. This thing is not quite what we thought. Let's say this is what we're able to do now. Here it is. Okay?
Yeah.
But it has to be a continuous conversation. It's not one of these where you wait until there's a problem. Someone says, guy,
We have
what?
a problem, guys.
You
Yeah.
see, by that time, the heckles are up. And people are less inclined to listen to each other.
Right.
The government is constrained. The government has needs that are constantly calling its attention. And there are many, and we understand. And that's why a lot of conversations are necessary. In the situation that we find ourselves in, those conversations are very necessary. But they have to be honest. Because if they're not honest, then don't have them.
They have to be honest.
And then we have to really be a country that understands that, yes, the government is constrained, right? We handle a lot of things, including the Eurobond, and we have deadlines here and there. But I put myself, Najita Mkutano, and I ask myself, what are our priorities? That's just the major question. Because ultimately, you have to handle all these things, but priorities. I don't know if I'm thrown too off.
No.
How are we prioritizing where we put the money? Which matter is of most urgency in that order?
I think we are. I think there's priority that's taking place.
Okay.
I think people are prioritizing. It's just not the priority that you think is.
It's not what- it's
People
not-
or
It's
governments.
not what you think the priority would, because you would think that the priority would be sending children to school, making sure that if you rock up to a hospital and trying to get medical care, that will be taken care of, making sure that the staple amongst people is actually affordable, things like that. You would think that's what the priority for certain individuals is very different from the priority of the majority. So in terms of priority, they're fulfilling. It is just not what would be prescribed by the rest of us. So in their minds, yes, it is a priority and it has been sorted.
And remember also, when you're talking about a discussion, what is the mindset of the citizenry of this particular country with reference to, one, the leadership, and I'm referring to the political leadership.
All right.
So, you see, many citizens are looking at this particular leadership through tinted glasses. The minds have already been made up. And when your mind is made up, it's like this government is XYZ, made up. So everything that you look at is from that made up mind. Mm-hmm. And this mind has been made up over time. It didn't happen in an instant. Promises made, not kept. Promises made, not kept. So thereafter, even when a promise is kept, you don't see it. That's the lens I'm talking of.
Interesting.
Because as far as you're concerned, these guys can't do anything right. So even if they do something right, you still won't see it. And then you get to a point where you actually don't want to see it.
It reminds me that there's a lot of things that are happening at the current moment, and the CS did actually give some light towards that. It's like the person who wants to go on a holiday, right? And you have no money in your pocket or your bank account or anything, but you show up at the airport and you say, okay, this is the plane that's taking us from point A to point B. Here I am, guys. And they ask you, okay, this is great. You want to travel? We have the facility. We can take you from Nairobi to Lamu. We can do that. We can also set up your accommodation and you'll be able to have a jolly old time. You can eat for the next 3 days. You can party on the, floating boat. You can do anything that you want to do. So, we can set you up with that. No problem. And you say, okay, great. Actually, that's what I want to do. Mm-hmm. And maybe a year ago, I decided that this is what I wanted to do. And I said, okay, I'm going to need a budget of, 100,000 shillings to be able to do that. And you say, okay, wonderful. Then you don't bother to put anything in the pot for the 100,000. Okay. You just say, we will cross that bridge literally when we get to it. So the 100K is just looking at you, waiting for you to say, please fill it so you can go. But you don't do that. But then you show up at the airport to take this flight, to go to this hotel, to do these fun activities, and you don't have a shilling in your pocket. Is that not sorcery? Is it not madness?
How is that supposed to happen?
How is it supposed to
A
happen?
miracle. Is it? How do you usually say that magic word? Abracadabra.
Abracadabra.
Okay, I do not know how to say it.
That is exactly what we are doing. We are doing abracadabra with people's lives.
I tell you what.
I'm telling you, that's what's going on. Because you say the money, it's those people who, like CT, who wanted to go and stand in front of KEMSA and hope that a contract tender will fall on his head.
No. Those presidents, we were told.
Somebody who went and prayed.
Somebody who was passing by. That's what was reported. They passed by.
KEMSA.
And they were called in and they were given a contract.
Like that.
Eric and I passed by so many times, we realized this thing wasn't going to work.
Yeah. So even if you
yeah,
prayed.
we had this company that did the sort of things that they said we could do. We said, guy, why don't we just pass by and see? We might be called. Man, did we pass by?
And man, did you not get called?
And man, did we not get called?
So that's what I'm saying. We cannot continue in a situation whereby you hope you will pray and then money will miraculously fall from the heavens inside level 1 and level 3 of SHA.
Do you know what irks me? Do you know what breaks my heart? Let me go social. Maybe a bit personal. That I am told to be patient, which I do not dispute. Patience is a virtue. It is important that we are patient. But be patient. When we have patience, people are losing lives, guys. It is that bad. And I'm not saying it's an interesting part if it is at your doorstep. But if you have a person in need of healthcare and you go in and there's all these complications, it really hits differently. Yeah. And if you have to use, it's easy for some people to just chuck some money, use cash up front. But it's not the story for every other Kenyan who lives below $1. So they really need this thing to work.
Ankey, can I ask you a question? These people who we chose to lead us, do you think they give a flying hoot about what you've just said?
They should give. They don't, but it's high time they know that we know they don't, and they should. Because this power they're exercising there is as ordinated to them for a reason.
You see, they also don't know that. They hear saying it, but they don't know it. The political class believe they are our bosses. It's an odd situation to be.
It's quite funny.
Yes,
actually.
we employ you and then suddenly you are our bosses and we're the ones who are paying you. It's odd. It's really strange, but it's what it is because these people don't behave like employees, do they?
No, do they?
No, they don't. They behave like actually bad bosses. Every once in a while, there's some statement made that's supposed to mollify you and make you feel that they understand and they care. The fact that I say I care, does it mean I care? No. If I care, I don't need to tell you. You will know. You will actually see it. You will know this person's intentions towards me are good. Why? Because you have witnessed it. See? So the situation we find ourselves in my mind, it's not a situation that is without solution. No. Solutions are readily available. The mindset and the will to actually find a lasting and sustainable solution at the expense of the self-interest that we see at the center of all the grievances that we keep talking about. Because how can you be deaf to all the problems? It is absolutely true that the price of many things have gone down. Problem is people can't afford even those low prices.
That you're talking about.
But which tells me that you need to understand the citizenry do not have the money. So they can't spend it. If they don't spend it, the government also won't have money. So it's a vicious cycle.
And you can't stop talking about it.
If I'm extreme, you talk about people dying by the bullet. You talk about people dying by the hand of terrorists. People die of hunger and people die when they cannot access medical care when they need it.
Exactly.
This is the Situation Room, the only way to start your day.